Hello, everyone, and welcome to the Know to Grow podcast. I'm your host, Dr. Ivan Khan, and I'll be breaking down topics around education, growth, and culture with the intention to help your own growth journeys. For those not familiar with our hosting organization, Consultorial, I serve as the CEO there, and we serve kids K through 12 in supplemental education centers throughout New York City. One of the unique privileges of my work is the opportunity to really know the various communities that our team serves and discover the various challenges that students face within themselves, their families, and overall community systems. Today I'm joined by a very, very special guest, Dr. Noor Ali. Dr. Noor grew up in many parts of the world: Bangladesh, Queens, Bronx Science, back to Bangladesh, back to New York and Tampa. She has a fantastic Instagram following with over 4,000 followers at Dr. Noor US Health. And more importantly, she's my baby cousin. So, Dr. Noor, welcome to the Know to Grow podcast. Congratulations on the milestone. We had a chance to attend your baby shower this past week. How are you feeling? You're the first pregnant person on the show that we're aware of.
Yes. Thank you so much. First of all, I want to say thank you. I'm an avid listener of the Know to Grow podcast. Huge fan. I've been listening from episode 1. I listen to it all the time. And I remember in the first few episodes, I was like, damn, I would love to be on this show. And here I am. So definitely feel like a celebrity. So thank you so much for having me. The baby's doing well. I'm doing well. As you see, I've got my little comfort set up here. So thank you so much again for having me.
You got the setups. Oh, you're just saying all that nice shit because you're my cousin.
No,
you're just listening. No. Not everyone in the family listens to the show. I kind of try to pick up on it and go out and so are you listening to anything new lately? Have you grown recently? And everyone's like, no, what are you talking about? I was like, oh no, nothing. But whenever we talk, whether we're texting, I'm going to be visiting you next month down in Tampa. How's, we're talking about the show, and, I just came to realize that, oh my gosh, you got this whole brand going on with your IG page. You got more than 4,000 followers. Let's start there a little bit.
Mm-hmm.
What's the focus of your Instagram page? And we'll start with your childhood after that.
Yeah, sure. So my Instagram page, again, the handle is Dr. Noor US Health. That's Dr. Noor US Health. What I do is I advise mainly self-employed professionals, startups, small business owners on their health insurance options. Mm-hmm. I find that, after the advent of Obamacare and the ACA, it helped a lot of people, but there is a population of people that were kind of harmed by it. In fact, those that make too much money, over 400% of the federal poverty level, really struggle with their options with health insurance. So that's the market or the population that I try to target and help them out with their alternative health insurance options, mainly on the private market.
So you're a doctor plus an MPH, similar backgrounds.
Yes.
I had a chance to work in healthcare coverage for employers around the time of the Affordable Care Act. And I'm glad that you weren't calling it Obamacare because it's a politicized term.
Sure.
So while it helped expand access for many groups, it did make it even, that challenge still remained for solo practitioners. So if you're a startup out there, you got your whole crew starting, you got your whole, your firm starting, how are you going to get, coverage for yourself or for teammates if your small organization starts to grow.
Right.
So that's what you're up to right now. Tell us about your childhood a little bit. Growing up, I had a chance to, hear about you for the first 6-7 years because your dad showed up on Linden Boulevard. It was May 89, a month after you were born. None of us expected the visit or him to be here. He just showed up. He's like, guess what, I'm here. We're like, what the freak? Oh, snap. And for anyone in my family who's ever met Boyshaki's dad, Tunulama, he's an avid musician. He's done a lot of music with some of the big legends in Bangladesh from our heyday. So tell us what life was growing up your first 7 years without your dad around, and then what was like moving over to the States. For a lot of non-South Asian listeners, they've never even heard of this kind of stuff.
Yeah, that's a great point. So just like you guys were surprised having my dad show up at your doorstep, we were surprised to have my dad kind of missing from our life. So that was a surprise as well. He did what he had to do, the struggles that all our parents went through to sacrifice and do what he had to do for our family. So growing up he left when I was 3 months old. My mom and I were in Bangladesh. He immigrated to America. I grew up pretty much without a father, a childhood without a father. So my biggest influence became my late grandfather, who was an anesthesiologist. And everything, I feel like who I am today is a reflection of who he is. His habits, his nurturing, his love and passion for reading, waking up early, all the proverbs he taught me. So he was a huge influence in my life in my dad's absence. So like you said, my dad's a rock star. He's a musician, he's all about that, the social life. And I'm huge on education. So that disparity really came from, my dad not being here and my grandfather kind of taking that role.
So that's your dada, right?
Yes, my dada.
And that's my Mejo Nana. So I was like, I didn't realize that he was an anesthesia. I remember hearing, you have a Nana and who was a doctor and they live in Malibak. And I remember visiting, Mejo Nana when he was, in the hospital much, much later. So that's pretty common for a lot of South Asian folks who've made that migration, where you didn't get a chance to be raised by dad. There were many, many periods in my childhood where I did not have my dad around for at least a year and a half or 8 months here because we were moving back and forth from the States to Bangladesh, and I relied on my grandfather. My earliest memories of adults were my grandfather, my dada, my nani. So did your love for, becoming a doctor start there? Did you know you were going to come back to the States? Tell us about that transition to the States and your childhood in Queens.
Yeah, absolutely. And that's a big difference. I noticed that, a lot of, kids in the South Asian community, they have their parents kind of pushing them or influencing them. Oh, this is what you have to be. You have to go into medicine. My parents were the complete opposite. They never told me, education. They never pushed me for education. They never pushed me for medicine. But I knew that I wanted to be a physician, specifically a clinician, since I was 10 years old. And that has never changed to this day. It's who I am. It's who I wanted to be. And that really drove, my career, my path, every piece of education I sought out to this day. And that absolutely had everything to do with my grandfather. Yeah. So when I immigrated, and no, I really didn't know how things were going to be. Obviously we had the intent of having our family together. So I came over to the States in 1995, and I didn't know a word of English, so that was challenge number one, assimilating to a new culture. But that love and passion for medicine that was deep rooted from Bangladesh, from, being around my grandfather all the time, that has always been a constant in my life.
So I remember in 95, I was probably just starting off at Bronx Science then. So, you got here when you were like 6.
Yeah.
Where'd you guys post up? Astoria, 36th Ave?
Yeah, Astoria, 31 Avenue, 23rd Street on the corner. That's, the first home I moved into. Never left then, just like a lot of immigrants who come into the States. So that's where I'm from. My subway station was either Broadway or 30th Avenue, N&W.
Depending on the mood.
Depending,
should I go past my house
which
or
way?
before the house?
Exactly.
Which way do I walk?
Yeah.
So you grew up in Queens in the mid-90s, like a lot of our listeners. You ended up in Bronx Science,
yes.
Which for those listeners outside, it's probably the greatest high school in the goddamn world.
That's right, you guys.
To all other heads.
Please write that in stone.
8 Nobel Prize laureates. What was that experience like? And did you know you were, going to be making a transition back to another country while you were at Bronx Science?
No, I did not know at the time I got accepted, but going to Bronx Science was a very easy decision. At that time, there were 3 specialized high schools. I got accepted into all 3. But again, knowing that medicine is what I wanted to pursue, and Bronx Science being a more science-focused high school that produced more healthcare professionals or science background professionals, my family and I, that was our first choice. This is where we want to go. This is where I wanted to end up.
So you're graduating, you're 18.
Yeah.
And your family's about to move back.
Yes.
You got 2 decisions. You could either stay back and try to stay back with khalas and uncles and aunts and all this other stuff, maybe even without my family. Or you can actually save a few years, go back home, enroll into medical school there.
Yep.
Rather than do the full 8 years in the States, you could do the 5-year bit at home. So what was that decision like for you? And tell us about that journey back to your homeland, our homeland at age 18.
Yeah. Again, a very, very difficult time for me in my life. I had a rough relationship, I remember, with my parents at the time because, my life was in America. This is, once I moved here, this is where all my friends were. This is all I knew. So it was very hard for me to accept that, okay, now we have to move back to Bangladesh. And there was so many factors that went into that decision-making process. My grandfather passed away. No one really did take care of my grandmother. And my dad was the one who stood up and took that responsibility amongst his brothers and sisters, said, okay, I'm going to do this. I'm going to, take care of my mom. and us as his family had to support that decision. So that's the cultural aspect of that was difficult. But the medicine aspect was super duper easy. Again, I knew I wanted to do medicine. I didn't see a point of doing a 4-year undergrad where I had to discover, or test out some passions. I knew that I wanted to go to med school. So I graduated Bronx Science in 2007. I was 18 years old. By the end of the year, I was already enrolled in a medical school in Bangladesh.
That's pretty incredible.
Yeah.
A lot of your journey overlaps with mine in the fact that I went to Bronx Science. I pursued a combined medical program right out of high school. You pursued medical school right out of high school.
Mm-hmm.
The other overlap is that when our grandparents got sick or passed away, it fell upon our dads.
Yeah.
You're from my mom's side, so when it for Doodle Mama, it fell on him to take more of the lead to fill that void that your dad had left.
Yeah.
In my own household, when I was in 5th grade, I grew up here my whole life, and it was like when my daddy died, the first thing was, as soon as we got our green card, we're going back to take care of Dada. And that was the reason why I moved back to Bangladesh. And it was actually attending Bronx Science or a specialized high school so my dad could help me become a doctor that brought my family back here, that led to consultorial, that led to so many changes in the academic trajectory of the community. Take us through med school abroad. Tell us some of the challenges. Tell us some of the incredible clinical advantages. So a little compare and contrast from some of the classmates that followed the similar pathways back here, and we'll go into our first break.
Okay, awesome. Yeah. So medical school abroad, very, very, very different from here. Again, I went right after high school. I didn't have that little transition period of undergrad to experience or find myself or find passions. It was like high school, medical school, accelerated program, boom. And where I went to medical school, it was Kumudini Women's Medical College. It was in a very rural area of Tangail. So I was away from the city. If you guys Google Earth it, you'll find that it's there's literally nothing around there. So the modes of transportation we're using.
Rural Bangladesh, right?
Yeah. Like you take a cow to buy your groceries, you ride
a cow, or the cow
pulls
a carriage? A cow carriage.
Cow carriage, similar. I guess that's the closest thing.
And you're riding on the back of it.
Yeah, you're riding on the back of it.
The carriage.
Yeah.
Okay, so for reference points, let's talk about some major cities. How far away is it from Dhaka?
It's 60 miles away from Dhaka. Given the traffic there, it took me anywhere from 5 to 6 hours to visit home on the weekends, which I would do once a month.
Once a month, 5 to 6 hour trip.
Yes.
Through the roads or the rural areas.
Yep.
To reach what's the closest major city?
It would be Dhaka City.
City.
And you need multiple modes of transport. So I would have to take that cow thingy or walk on foot to driving. There was no bus stop there. So there would be a bus going, 60, 70, 80 miles per hour with a broken speedometer on the highway. I'd have to literally jump on and jump off because they're not going to stop.
So you thought taking the N to the 4 train was fucked up, took all the way to Bronx Science as a high schooler, and then you're like, shit, this is...
So my commute,
is literally shit.
It went from N to 6 all the way up to Bronx to taking a cow to a moving bus in the middle of nowhere.
So it's been a pleasure to have you on so far. It's about time for our first break. To all the listeners, Health and Life with Dr. Noor, Us Health. We will be right back after this. The Noor Podcast. You are listening to Health and Life with Dr. Noor, U.S. Health. Before we left for our break, Dr. Noor was telling us about her experiences going to medical school abroad, particularly in a rural setting. When you kept in touch with your friends who were pursuing similar pathways of pre-med and taking orgo and taking their MCATs and going through the medical school process, what were some compare and contrast you heard about through the experiences as a medical student and a clinician in Bangladesh to the opportunities they were getting here? Take us through it.
Yeah. So there's a difference in the entrance process to medical school in the States versus what I did. So at the time when I went in, there was a different entrance exam for each school that you applied for. Now it's more standardized, similar to the MCAT. But my experiences were more the clinical aspect of it itself, really third year onwards when I was working with patients more. So the patient population that I work with were very, very, very poor. And I'm talking they were monthly household incomes of less than $1 a month. So not only, they were lacking education, they were lacking the financial stability. So not only that aspect, these patients would come to the hospital knocking on death's door, really, because they didn't have the means or the knowledge really to seek care.
So you saw a lot of critical patients already in a very ICU critical condition.
Absolutely. Also because the hospital that I worked in, Kumudini Hospital, it was at that time, it was the only hospital in a 75-mile radius, and then later on in a 50-mile radius. So we attracted a lot of patients, but the patient population themselves were just of a category that really, it was difficult to help. So
this is straight out of the boards. It's God forbid, it's a stroke patient case.
Yeah.
How are you going to make it on time? You got a 90-minute window for this, and you got a couple of extra hours for that.
Yeah.
And so those types of situations, you'd see deterioration or death just because of lack of transportation access.
Yeah, on a daily basis. That was my life. So I had to learn how to, because of the lack of availability of not only technology, tests and imaging, my patients couldn't afford more than a test at the very most. So I had to learn how to diagnose with my hands and heal with my mind, which I found now I realize more how much of a powerful skill that is that I learned, and really compare and contrast Eastern and Western medicine. So for example, I can palpate a liver and tell you the degree of cirrhosis. I can visually assess the stage of a cataract without any instruments. I know how to gauge a hemoglobin level just by inspection.
You ever mess around and test it out on the with your colleagues back here? You're like,
oh, absolutely.
I could palpate it. You can MRI it. Let's place a bet.
Let's play. All the time. Like hypothyroidism, I can diagnose a hypothyroid case without a single test. Just by looking across the room, just with a handshake or just looking at you. Yeah.
This little call, yo, I see you. I got you. So this is pretty revealing. Having gone through not anything similar, but the overlap is being in clinical settings in underserved environments like Harlem, Flatbush, Brooklyn, and realizing that the emergency room is oftentimes their first, middle, and ultimate line of care. And when you compare it to neighborhoods like Long Island or Westchester County, it was very different for us to realize that there's a whole world out there, clinical experience to what the imaging can tell you. And while there's a great need for confirmation in medicine, so people get sued and prevent medical error, of course, a lot of it does come down to just how great your clinical skills are.
Yes. I
need to take the conversation to a very serious note. In 2013, Bangladesh went through a tragedy in the Rana Plaza disaster. Please take us through what the Rana Plaza disaster is for any non-Bangladeshis. It was the cover of Time magazine, especially one of their images for pretty much the entire year, all the way to the final episodes, final editions. And how were you involved in the Rana Plaza aftermath? Please take us through that.
Yeah, it's emotion inducing. It's a true tragedy. The Rana Plaza tragedy in 2013 took place in Shavar area of Dhaka. And what happened there was it was a garments factory that collapsed. It collapsed without any warning. It collapsed with zero preparation. The building itself was not equipped to handle, the number of people that were working there, the garments workers there. There was no exit strategy. And as a result, hundreds, official reports say hundreds, but I've been there with my own eyes and I've seen thousands. People died trapped in the rubble. And at that time, it was 2013. I just finished my final boards for medical school, and I was, waiting for my final degree conferral. So I was in a provisional state. So I considered, I didn't get my results yet, but I considered myself a doctor. Like I'm, provisionally licensed.
I finished the schooling. I got the degree. I'm just in the process
Just
of
waiting for
completing
the
my
paperwork.
license
Yeah.
paperwork to come back in the mail.
Yeah.
So where are you when you hear something just went down?
Yeah.
It's like, over here we're all like, we all remember where we were on 9/11.
Right.
So where were you when you heard the news about Rana
Yeah.
Plaza, and what were your first immediate steps? Take
Yep.
us through that.
So I happened to be home because I just finished my board. So I came back home in Taka. I saw it on the news, and I didn't think it wasn't a choice of what do I do now? Like what are my responsibilities or duties as a young doctor, as a young professional? How can I help? I want to do something to help. I immediately called up every single doctor friend that I had in the area, and I said, we're going there. We're going there to help. And there was no real plan or strategy for search and rescue. It was like whatever anyone is doing, they can do. And because of, the high risk situation, the situation, there was no transportation to reach there. But we didn't care. We just went there. We went as far as we could, and then we had to walk about 2 miles to the actual site. And when I got there, it was a mess.
So right now, when you're home, you're in
Yes.
Taka, or you're by the medical college?
I'm in Taka.
You're in Taka. You know that it's like 25, 30 miles right
Yes.
outside, like this, like
Right.
the city, like the actual borders, and
Yes.
you're traveling out there. And now you got 2 miles. Got to get out. You got to start walking because it's an emergency. There's a gridlock.
Yeah.
So you guys are walking.
We were walking, and
running.
even that 20, 30 miles to get there, I had to travel. It's really hard to describe those trucks that carry animals with cows and chickens to transport those. I got on the back of one of those to get as close to the site as possible, just to get there and then walk the rest of the way. So really anything I could to just get there. And my parents were very, very concerned. I didn't really ask anyone's permission. I said, you know what? Someone's got to do something. There's no plan here. People are trapped under rubble. We got to get them out. I'm just going to go and figure shit out. I remember my parents being very concerned, but they understood. They understood where I was coming from. So they didn't stop me. So I get there, walk 2 miles there. And what I saw or what I experienced, I still remember there's really no way to get into the building other than just some makeshift ladders that were just propped up against the rubble. And I was a woman, and one of the firefighters were concerned, and they said, and then I'll never forget this, because they said, we're concerned, you don't go there. Your life is more valuable as a young doctor than the people trapped in there. And I looked at it and I was like, what are you saying right now? I could not understand his perspective at the time, and he could not understand mine.
So they're like, we need your expertise to help save as many people when we have light back, or when we have a little bit more technology to help remove something. But we need you alive and healthy.
We need you alive and healthy to help treat them when we can get them out.
Yeah.
But my perspective was like, I got to do something now. I got to do something as soon as I could. And I pushed him to the side, and I went up the ladder. There was an adjacent building that they created a hole to access the pile of rubble.
Yeah.
And I mean, what I saw inside, there were just, bodies piled on top of bodies. Every step you take, I accidentally stepped on a body, and you turn to the right, you turn to the left, you see a body part in that, you hear a cry, you want to follow it, and then you find out it's just an arm, it's not an entire body. It was an extremely traumatic experience, and I did what I could and we had no instruments, we had nothing. You want to help someone come out, you don't have the equipment to do it. You want to help someone relieve pain because one of their arms are trapped. I don't have, I have a medication. I have a lidocaine, but I don't have a syringe to apply the lidocaine.
Yeah.
The closest medical college there was Inam Medical College in Shavar. So what we did was we had ambulances. Whoever we could rescue, we would just shuttle them back and forth. So I was going back and forth between the site and the medical college just to do whatever we could.
Wow.
Yeah.
How many days did you get to visit? How long? I mean, clearly you got there pretty early within the first several hours.
Yes.
as resources and rescue recoveries setting themselves up. So how many times did you get to go back in the first few weeks?
Just the first 2 days, and by that time we had most of the people that we could rescue out. I think up to the first 2 weeks, the last person alive rescued was by the end of the second week. So I was there for the first 2 days.
How long did it, that will probably stay with you forever, like the trauma of that.
Yes.
So touching on that, how long did it take you to get through it. As a medic in the community, you see so much shit. And you're like, all right, you're used to it. You're used to seeing even elderly people or children in places of pain. But how long did that? Because that wasn't in a medical setting. It was just
not at all.
A effed up tragedy.
It was completely unexpected, and it was before I was really a licensed practitioner. So it was before I started really working as a physician. So I definitely was not prepared for it. It was actually one of my colleagues who noticed that I was very, very, very traumatized and actually depressed after that episode, and I didn't really recognize it myself. And some of the things that would happen was, I would try to sleep or take a nap, but the slightest sound would wake me, and I would just see, visualize, bodies under my feet, bodies that I couldn't help trapped in the rubble. So it was another colleague who recognized and said that, hey, you're traumatized, you're depressed by this. Maybe you should consider taking some medication or something. So that was rough.
So how long do you remember it taking for you to go through that journey of that adjustment, of facing the trauma and, coming to terms with it, accepting it, registering it, digesting it, all of it?
I think 3 weeks, the first 3 weeks, I was completely abnormal. I was completely jarred. And the way I dealt with it at the time, I didn't recognize, the changes that were taking place in my mood. So other people did. The way I dealt with that is I wrote. When I have a strong emotion, I find myself to be a very good creative writer. So I wrote about my experience, and that helped me, and I published it. And then it took me, I would say, at least another 3 months before I could kind of not visualize the trauma, not have every single thing in my day-to-day life connect back to that incident.
Man. If we fast forward, what's next? What did you guys do after that?
Yeah, so we actually, after all the rubble was cleaned up, and we formed a coalition, and at that time there was a lot of political strife, as there always is in countries like Bangladesh, but no one really took responsibility for the incident, and in fact they declined international aid. So we formed little coalitions, people who wanted to help and do the right thing. So what we did was I was part of another group that just followed up with the survivors and helped them any way they could with counseling, with financial support, with kind of rehabilitation for their families. And I did a bit of that work. I was part of a team for another year following the incident.
So over time, your professional life and your personal life are becoming aligned.
Yeah.
You're, coming back to the States, and you see that there's more to grow, not just through your clinical experiences, but more in the public health sphere. And that's something that I went through also.
Yes.
Let's hear a little bit about your public health experience before we go to our final break for the culture section.
Okay, awesome. Yeah. So public health, I happened to do a ton of work in the public health sector when I was living in Bangladesh, just because the opportunities there were so great. In fact, one of my biggest achievements in my life was I started this community project called Improving Maternal Health, which was using Junior Chambers International, JCI, as a platform. It was a 2-year community health project where I set up free antenatal camps in different slum areas all over Dhaka City. And it was hugely successful. It was recognized by the United Nations in the 2014 World Summit. And it was
This is through where?
This is just a project I started on my own. It was an extracurricular activity.
So nothing to do with your public health?
Nothing to do with school or public health, because I was in medical school at the time.
So that could have been a bridge.
Yeah. So I would get like a day off a month, being part of an accelerated med program. You really don't have a lot of time off or downtime to do anything. But I would take that day to pre-plan these camps and go all over slums and really serve that population of pregnant women who have very limited access to care. So that was a hugely successful project. I loved doing it. I had guests from all over the world. I developed a lot of connections and stuff. But what I realized at the end of that project was that I did not really have a formal public health education to kind of maximize or optimize my goals, objectives, and outcomes for that project. So that's what really led me to pursue a degree in public health, was to really formalize my experience and learn proper research methodology and how I could have closed out that project to maybe result in a paper or publishment, which at that time I didn't have the knowledge or skills to do.
So we're definitely going to have more episodes later on the field of public health. I have gained my public health from downstate. Nipa at home has hers from Columbia, and there's a whole bunch of different fields that you can do within it. Take us quickly before our final break, where you did your public health, what that experience was like, and then we'll talk a little bit more about how you put it all together in your current career in life.
Yep. So I completed my public health, my master's in public health from the University of South Florida. That's where I live now. It's close to Tampa.
USF, what up?
Yeah, USF, go Bulls. And I also completed my CPH, which is a certificate as a professional in public health, and I also did a graduate certificate in infection control and prevention.
So, would you recommend a public health for those wanting to go into healthcare, however, do not have the inclination towards clinician stuff?
Yes, absolutely. And public health is so huge. It's vast. It's humongous. So, there's a movement called What is Public Health? When, there was a big campaign that I want to say was about 4 or 5 years ago. And there's so many sectors. You can go into policy. You can go into, global health management. Absolutely. Law. Exactly. Epidemiology, biostatistics. Oh my gosh.
International.
It's huge.
Everything.
So everything. There's so much opportunity in public health. What I did was global health practice because I have so much international experience. I was recently in Australia as well for research. So really it helped me connect all my experiences. Australia.
You got listeners on in Australia.
Oh, good. Well, shout out to us Aussie listeners then.
Shout out to Mac Links and Minto and Rafakala and everyone.
Oh, yeah.
So on that note, we're having a lot of fun. Let's take our final break and we'll come back and find out a little bit more about, outside of the wards.
Cool.
I got no rules, I count them. 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 I got no rules.
And we're back to the Know to Grow podcast. I'm your host at Dr. Ivan Khan. Today's episode, Health and Life with Dr. Noor, U.S. Health. Before the break, we were chatting with Dr. Noor about her transition from a clinical setting in Bangladesh in medicine to bridging that with public health internationally, bringing those talents to South Beach, and now completing her master's in public health to have your current work, your page, you're a global health advisor, you're certified in public health, you have all these official degrees and experiences. Tell us about your Instagram page now and your current work. How are you tying it all in?
Yeah, so my current work, again, I do health insurance advising for self-employed professionals, and I use my medical background to specialize in medically underwritten policies. And this is, I feel, something that not a lot of people know about. They know about the healthcare marketplace, about the Affordable Care Act. You go to healthcare.gov and you shop for your plans, but there's private plans out there such as medically underwritten policies, which may be a better fit for some people. So I use my clinical background to evaluate people to see if they'd be a good fit for something like that. And I use my knowledge and understanding of global health systems to really advise, professionals on the best health plan for them.
It's so important. You got clinical,
Yep.
you got wellness,
Yep.
you got healthcare access.
Yes.
All three things covered. You're a Queens girl. You sound like it. The hell took you out to Tampa. So for all of the listeners, while you've grown up as my cousin, when I was finishing medical school around like 2007 at SUNY Downstate, you were probably in the middle of medical school or somewhere.
Just starting out. Just graduated high school. Just starting.
And I think a few years later, I came to realize that you had gotten married to someone from my own childhood, and it became such a small world to know that, hey, one of my best friends from childhood ended up growing up and connecting with my cousin, and now you guys are married. So Tell us about life in New York. Tell us about what took you guys back to Florida. What roots, your husband has there. He's from freaking Bay Ridge.
Yeah, Bay Ridge, Brooklyn. Yeah, I know. Shout out to my husband, who's awesome, by the way.
Yeah.
So we decided to move down to Florida. My in-laws lived there. My husband bought his parents a home to retire in about 8 years ago. And when we decided we wanted to have a family, we wanted to kind of settle down and grow our roots, we made the decision to move closer to them as they were getting older. We want to be good caregivers.
So your in-laws, uncle and auntie,
yes,
they've held it down. They've had a small business in Brooklyn and Bay Ridge
That's
for
right.
30 years, raised a family. So around their retirement, for all the South Asians listening, it's common in our culture to help take care of our folks, and whether it's like helping make sure, just to look out for them.
Yeah,
and
absolutely.
then just help them with their retirement, help them with the move, and look over that. So you guys went down to Tampa.
Mm-hmm.
What was that culture shock like? I mean, that must have been worse than moving back to freaking Dangal.
I think so. Yeah. So I thought, living in Mirzapur, Dangal, and riding on the backs of cows was hard. And then I had to go to Florida, and all of a sudden I'm this exotic thing, and I'm surrounded by all these Trump supporters in a very red state. And they think, and I don't know how to drive. And they're like, well, you're 26 years old? What do you mean you don't know how to drive? Because people in Florida, they learn how to drive when they're like 14 years old.
And your husband's from he's a brown guy, but he's from a conservative neighborhood.
Yeah.
So he understands a conservative mindset, but he's not a conservative himself.
No.
So he must have been like comedy for him inside.
Yeah. It was ridiculous. So it was a culture shock for me there. I had to learn to drive. I had to learn to assimilate. And I think this is important for a lot of people growing up in New York City. Is when I was growing up, I thought New York City was the world.
Yeah.
I thought New York City was New York.
Still is.
It still is.
Yeah.
But then you go down to places like Florida and you meet all these New Yorkers who come down there to retire.
Yeah.
And they're like, oh, I'm from this part of New York, which I've never heard of because it's like not New York City. I'm like, okay, sure. And they're like, where are you from in New York?
We're talking about 5 boroughs. We're talking about Queens,
Exactly.
Astoria, what block, what corner, what apartment.
That's New York.
That's my neighbor. Oh, shit,
Yeah.
I know my neighbor.
Exactly, yeah. But then there's so many New Yorkers in Florida, and they call themselves New Yorkers. I'm like, you're not really a New Yorker. So that was a challenge as well. Just learning and understanding like New York City is
I'm
not
from New York
the world.
too. Then why the fuck you sound like this for?
Yeah, exactly. Have you guys ever heard a New Yorker sound like a Southerner? They're out there. It's weird.
It's like, yeah, I'm from New York.
Right. Yeah.
So how far along are you now? Tell us about your pregnancy. Tell us about some of also like the culture down in Florida. I mean, you got your in-laws. You guys aren't living in your same place. How are you about tell the viewers a little bit about the pressure of being a South Asian professional woman, because you're clearly, the big, the unspoken topic in the room is like, oh my gosh, how can South Asian women have a career and be a mom too?
Yes.
Tell us about your experience with that archaic mindset
Right.
and how you're tackling that to,
Right.
undo society's, traditional gender roles.
Yes. And I think especially for women who are, I hate the term overachievers, but I want to use it to describe people who have these certain goals and accomplish, goals that they want to accomplish, and not having accomplished them makes them feel underaccomplished. I'm not expressing this properly, but especially for women like us, who want to please their in-laws and be a good role model in the family, as well as excel in their career.
So how can you be goal-oriented in your own shit while still, being happy to keep things happy with your family, your overall family structure?
That's right. Yeah. And some of the responsibilities and expectations that come with that role is, are you spending enough time with your in-laws? Are you, cooking meals at home, or are you ordering takeout after, a long day at work? And I really struggled with this until I read a certain book, which I recommend for absolutely everyone. It's called The Four Agreements by Don Miguel Ruiz.
Yeah.
And it's an ancient Toltec principle that's been passed down in generations. And it was a challenge for me to really understand the message. It took me a while, but it's become such a fundamental part of our lives now. My husband and I, we actually have it framed in our house, the Four Agreements. Yeah, he read that shit because I told him, and then it really helped our relationship. So
Four Agreements
oh, yeah.
by Don Miguel Ruiz.
Oh, yeah.
What were some of the favorite takeaways for you and Mo?
So what we learned from that, but we had different takeaways.
Okay.
But we had different takeaways, and then it affected our relation, and our relationship enhanced significantly from that book as well.
Ooh.
So in relation to, roles as a South Asian woman, the biggest thing I learned was to let go of society's norms and expectations and release that fear. So I realized I was so stressed and anxious about pleasing my in-laws, about, meeting these standards and expectations. I wasn't myself. And that made me deeply unhappy.
And it's not because your
stressed
in-laws are
out.
bad people. Like,
No.
your in-laws are incredibly nice.
They're
fucking
awesome.
people.
They love us. They're so
You're
great.
lucky. It's like,
Yeah.
oh my God, you're so lucky that like their in-laws are nice, but still there's that cultural clash.
Yeah.
Especially like you have done all this. You have all these other experiences in your career that you're still seeing through.
Yeah.
So
Yeah.
it's that balance.
Yeah. So it wasn't, it was like you said, they're great people, but it's this pressure that I put on myself because of that expectation that society has built in that, you have to be X, Y, and Z. My husband and I work so much, we come home after like 12-hour days, and then I feel guilty if I don't call my in-laws and ask how their day went. So that was a stressor on top, that, that expectation that maybe, I should be calling, and I'm tired as hell, I don't want to talk to anyone after being on the phone for 12 hours.
We're about to have some mother-in-law, father-in-law episodes on the Noor podcast. Come through.
Yeah.
I'm going to have live callers down the block, like call in with your favorite mother-in-law episode. And,
that's a great idea. That's a great idea. So yeah, 4 agreements really taught me to let go of those fears and release those expectations from society. And then that really helped me, really calm down and become stress-free that what I'm doing is great. I'm balancing my life, I'm balancing my family. And one of the ways I like to do that is compartmentalize. It doesn't sound like a positive word at the moment, but what I mean by that is, when I'm at work, I'm working. I don't think about family. I don't think about expectations. I am all about my team, all about my work. I give my 100%.
That's my favorite word. I don't know why you even question it. Go on.
Okay, good. And when I'm home, I unplug completely. So no phones at the dinner table, no phones, period.
Ooh.
None at all. So if my team trying to reach me, I know. I tell them, like, I'm sorry, guys. If you're going to try to reach me, you can't. If I'm home, I don't know where my phone is.
During dinner. Okay.
Exactly. I don't even know where it is. So definitely unplugging and compartmentalizing that. My husband travels a lot for work, but he always tries to be home on the weekends. So when he's traveling, I don't bother him because he's the same way. He's 100% about his work. When he's home, he's all about me. He's giving me time.
He's like, he likes to work hard, but when you get to hang out with him and you don't have work on the way, oh my God, it's a riot. So before we leave, where can we find you? Mm-hmm. We are going to be visiting you in a few weeks down in down in Tampa. Can't wait to continue this conversation. Maybe we'll carry it back to our IGTV on the Noor podcast. So where can we find you, and any final messages for our listeners on the Noor podcast? Your fellow listeners.
I know, exactly. I'm a listener too. I'm a huge fan. So yeah, you guys can find me on Instagram or Twitter. The handle is the same for both. That's Dr. Noor US Health. DrNoorUsHealth. And on my Instagram, I have a video series which I recently started. It's called #AskDrNoor, where you guys can submit questions about health, wellness, health insurance, open enrollment, which is coming up. It's a huge time of the year. And I answer that one question every Wednesday. So you guys can follow that and catch up with me there.
Dr. Noor, my little cousin Boishaki, it's been such a pleasure. My fellow Bronx Science alum.
Hell yeah.
Cousin from Queens. I was telling Nipa the story of your and my, connectivity, since you and I grew up in various parts of the world throughout our lives. And just remembering, it was 2002, 2003. I was coming back home from med school, and I think you were in junior high. And I came home one day and it was 1 a.m, and I was about to go to bed. I was like, hey, what's up? What are you doing here? And you're like, yeah, I'm getting ready for Sahari. I'm going to be fasting tomorrow. And here I am coming back. I was like, oh, that's right. Oh, let me give you some company. And then, from there, obviously we've had so many fun overlaps since then. And my kids love spending time with you. It was one of their favorite foopies. So I can't wait for our trip to Tampa.
Yeah, it's going to be so much fun.
All of the listeners, thank you for joining us for this very, very special episode on Health and Life with Dr. Noor US Health. We are on episode number 15 through 20 right now. We're in that phase of it. So for all of our listeners, now's that time where you can start sharing with your friends. We're about more than 500, 600 downloads. We have, dozens of active listeners, but if you're listening on Apple iTunes, please give us those 5-star reviews. Hit up the comments. If you are listening on Spotify, hit up the share button and send it to your favorite and largest group chat and be like, yo, this is my favorite episode. Check this out. We're really going to be picking up our promotional marketing in the next few weeks to months. So I can't wait to catch you out there on social media. And thank you for joining us in Know to Grow. And until next time, always remember to pay it forward.